Carpal tunnel, basically think about it, it's at the tube. At the back wall, it's all the carpal bones, and the front is a very tight transverse carpal ligament. It's like a sheath. This is formed a tube. Inside, there are 9 tendons, 1 nerve. The medial nerve located very much on top. So you have a tube, you have 9 tendons, 1 nerve occupy this tube. If the inside of the pressure goes up, same thing like when you sit over there for 2 hours, you can't feel your leg, you can't feel your feet. It's because of the nerve got pinched, so they cannot transfer the information. You don't feel it. That's the reason. When the inside of this tube, the pressure goes up, you cause the damage, cause a problem for this medial nerve. Certainly you have numbness and tingling, that's a basic thing. There is one very important thing, it's called the nocturnal symptoms. So if you have a problem with this one and you wake up at the middle of the night and your hand is numb, you can't feel it, you have to do this, and that's number 1, nocturnal symptoms. Number 2, a lot of people actually, they have a problem when they're holding the cell phones. When they're holding the phone talk, after certain 5-10 minutes, the hand is getting numb. And another one is that to drive. When they drive, they put a hand like this. They were saying that, okay, after a certain time, my hand is getting numb and getting painful. This is what I see from my patient, most of the common symptoms. If you started having numbness and tingling, you should pay attention to it. And there are 2 symptoms, 2 clinical symptoms I want to make sure you see doctor right away. Number 1 is that you have persistent numbness tingling. You feel numb tingle all the time. That means your nerve got pinched. You have symptoms all the time. You need to see a doctor. And the second is that watch the center muscle. The center muscle is a piece of muscle right next to your thumb. If you feel that muscle a little change, atrophy, anything, you need to see doctor right away because center muscle atrophy is not going to come back. That's actually the good indication for the people to have surgery. Always you started with a conservative treatment. The conservative treatment including, you can do the modified activities, make sure your work environment is not too much of the, with the wrist twisting and bending and ergonomic evaluation. Number 2, you can use a wrist splint to keep the wrist straight at night to avoid the nocturnal symptoms. And the number 3 is that sometimes I do a cortisone injection for the people, for the older people or for the people with pregnancy, if they cannot have surgery. That's a conservative treatment from our literature. Certainly, other sources, they have some other reasons, but from our literature, the conservative treatment, basically this is the 3 conditions I treat them conservatively. Second is about the surgery. Indication for the surgery is that number 1, again, like I said, 1 is a persistent numbness and tingling. Anything if they have intrinsic muscle atrophy, that needs to be taken care of with the surgery. And sometimes another indication that if the patient had the nerve conduction test, they have severe compression, and also if the patient already having a long-term history, like 5-6 years, tried everything, not working with conservative treatment, that's another indication for the surgery too. Surgical treatment, there are different kind of the surgical treatment, and now we talk about number 1 is that we use a traditional opening technique. This is a very mature surgery, and that our incision is only about 1/2 inch, and the operation take about 30 minutes. You come and you go. And this one take about 4 to 6 weeks of the recovery. The good part for this thing is that you see the nerve all the time. You can avoid any, better to avoid the complications like, nerve damage, whatever the same, because it's right underneath of your eyeballs. There is another option that people now talk about a lot is that endoscopic, carpal tunnel release, and I only do the traditional opening. The endoscopic I trained during my fellowship. I do have some reservation for this thing, but it also has good indications. And that one recover is similar to the opening, And the advantage for this one is that you have less pain for first about 4 to 6 weeks of this after the surgery, but the rest of the thing is very similar.